I would say don't go directly to the insurance company for information. If you really want to get an unbiased recommendation, just find a broker. What's up, everybody? This is Chris Franchina. I'm one of the co-founders here at Policy Engineer. Next to me, I have Richard Eggers, who's the head of our videography department here at Policy Engineer. Today, we're just having an open conversation about Medicare. We talk about enrollment periods, CMS changes that are coming. So stick around to the end of the video because we give a lot of good information. All right, so the Medicare Annual Enrollment Period starts it's October 15th through December 7th. And that's an enrollment period you have every single year. It's annually, and you can make as many plan changes as you want during that time period. Also, the insurance companies every year in October, they have all of the new announcements for their plans come out at that time. So most important thing, you want to make sure your doctors are in network going into the next year because they do make changes. You want to make sure your prescriptions are covered going into the next year. And then once you've checked those boxes, then look at all the bells and whistles and stuff. Because the insurance companies, they're competing with each other. So they want to have the better bell and whistle every single year. They're going to compete. But make sure first, prescriptions are covered, doctors are in network, then shop the plans every year. And don't be scared to change your plan.
What's a more busy enrollment period, OEP or AEP, and why?
The annual enrollment period's busier because you can make as many plan changes as you want, usually. And that's like the big one that's marketed all over the place. There's restrictions on how you can market the open enrollment period from January through March 31st. So you don't really see that many TV commercials going on. You don't see too many advertisements going on around that time. It's really almost like a security blanket for people. Like, let's say you made a change during the annual enrollment period in October. You go to the doctor, you go test your plan, and you realize, oh, I hate the plan I switched to. Well, you get another opportunity. You can make a change during that time. There's also some restriction on what you can change to and how many times you can make a plan change during the open enrollment period. So you can change one time during the open enrollment period from January through the end of March. And then whatever change you make, it becomes effective the first of that next month. And essentially, I mean, you can look at the complex details on the Medicare website, but essentially if you're going to make a plan change during the open enrollment period from January through March, really you're only making a plan change if you're starting with a Medicare Advantage plan. So you're switching from one Medicare Advantage plan to another one. You can switch from one Medicare Advantage plan to original Medicare, the parts A and B, and you can have a Medicare supplement policy and a prescription drug plan. You can't really switch back from original Medicare back into a Medicare Advantage plan. That's like one of the restrictions you can't really do during the time. So annual enrollment period is key. That's the big one.
Seems like a lot of information.
That is a lot of information.
So for someone brand new to Medicare, let's say, they know they got to sign up, completely new to it. They have no information. Let's say they know nothing about the system other than they have to sign up. Where would you send them, or how would someone start?
So the first thing you got to do, well, one, you have something called your initial enrollment period. Now, that's a 7-month window. You get 3 months before you turn 65, the month you turn 65, and 3 months after you turn 65. That's just to enroll into original Medicare. So you first go to ssa.gov, get yourself enrolled into the Medicare system. Then you have your plan shopping at that point. But you got to be active with Medicare first. Then you can start looking into the insurance plans that are going to go with it. Now, first decision you got to make is what style of healthcare makes the most sense for you. Like if you're a person that has doctors that are spread out all over the place, or you have multiple doctors, maybe not within the same medical group, or you just hate getting a referral from your primary in general, then you want to probably look into something that has an open network, like a Medicare supplement policy. They're called Medigap plans also. You have nationwide access. You go to any doctor in the United States that takes original Medicare. You don't have to get a referral. You have open access. On the other side of the coin, if you have a really tight medical group, you have a primary that you love, they give speedy referrals, then a Medicare Advantage plan might be a really good fit for you. And typically those plans are going to have baked in bells and whistles, extra areas of coverage that original Medicare does not cover. So pick the style of healthcare first, and then go into shopping and look at like the premium of the plan. What are the copays going to be for your doctor? What's the deductible on your medications? Look at all the little mini details and stuff after, but find the style of healthcare first.
So like do all the essential stuff first. Like make sure doctors are network, prescriptions.
If you break it down into steps, get enrolled into Medicare first, into the government system, then figure out what style of healthcare makes the most sense for you. then start to shop and compare. There's probably, honestly, depending on where you live, especially if you live in Southern California where we live, there's like 100+ different plan options you can choose from. So it's overwhelming. So eliminate like half of them first, figure out the style that makes sense, and then go shop and compare. And if you're going to shop in general, either on the Medicare website or if you're working with an agency or an agent, make sure they have access to technology. That's really the only true way you're going to get an unbiased recommendation on what plan you should go into. Without that, there are still agents out there that are living like a decade ago, and they have just portals to every single insurance company website. If you give them the medications you take, then they got to go and research through every single insurance company and what your copays are going to be. And it's really hard for an agent to really give a solid recommendation if they don't have access to good technology. So find someone.
Do you think people are hesitant to do that and move into technology? Because I feel like there's a big part of technology that you don't know. When you give out information, it's a lot of personal stuff and things like that. Like, are people hesitant to do that? Or like, what's like the dance with that and trying to get people to trust you, to trust technology?
I mean, it's definitely something people are getting more used to, trusting technology in general, but you don't have to do the work yourself. I mean, just make sure the agent or the agency or whoever you're working with, they have access to the technology. If you have a trained agent that knows their stuff and they have access to a tool that can point them in the right direction to help you pick out a plan, then you're solid. You're going to head in the right direction. Like what we do, a policy engineer, we use the tools. We'll plug in your basic data. We'll take down your medications. We'll make sure we have the doctors there. Any pharmacy you go to, we'll plug it into the tool, but you're a part of the process. Anyone you meet with on our team, they're going to actually screen share, or if you're in person, you're going to be with them at the computer. You're going to filter through the plans together with the agent. So you're a part of the process. You know that you got a plan that fits your needs specifically, and you got to be a part of that whole entire like decision-making process, essentially.
Now, do a lot of agencies do that? Like you said, there's a lot of people who kind of do it a little more dated and kind of one by one, but are there a lot of places that do use technology? And
I think more and more every year people are catching on. I mean, you have these big entities that are creating this technology and making it available to agents. Sure, I mean, you have people that have been in the industry for 20, 30 years that are just, they've had a way, they've done it for a long time, and they just stick to the way. But to be successful in the industry now, you have to adjust. You have to have really good tools, really good technology, or you're going to get left behind for sure.
Speaking of adjustments, I know Medicare is making some big changes.
They are. They're making huge changes in 2025.
Anything you want to talk about as far as changes happening or that have already happened?
Yeah, for sure. I mean, we're doing events coming up that are going to go over all the changes. So just go to our events page on our website. But a big change is the prescription drug coverage. The prescription drug coverage, they put a limit now on essentially what you would pay for your medications. We're going to have all that information on our website. But CMS, Medicare, they're going to officially release the numbers like the Part B premium, the actual Part D changes that are coming, the Part A and Part B breakdown. They're going to release all of that stuff really, really, really soon. Sometime in October, they're going to actually release the final numbers for sure. But if you take expensive medications, you are 100% going to save money in 2025. Not literally everybody, I shouldn't say 100%, but a big portion of the population that pays thousands of dollars already for the medications, you're going to get a break because they're lowering the threshold.
Keep an eye out for that.
Keep an eye out for that.
And then on the internal side of things, because we do all the marketing for policy engineer and stuff like that, and they're changing the way that, I guess maybe a good way to put it is how agents interact with clients and stuff like that, like the process of how we're marketing, how agents have to market. Like, do you want to go into that a little bit?
Yeah. I mean, so there was the CMS compliance change. It's for insurance agents, essentially. You have to have any lead form that a person fills out to request information from you. They have to fill out a permission to contact on there. And that's been around for a while. People have to fill out a permission to contact. But this year, they made sure the permission to contact slip that you fill out when you request information, it has to be a one-to-one permission to contact. So you're filling out the form. On the form, it should say, I'm literally going to be speaking with this agent. I'm going to speak with John Doe at XYZ agency. And that lead or the person that requested the information can only be passed on to that person. But a lot of insurance agencies that have been, running marketing for their employees or for their agents for a long time are going to be affected, because if they're 1099 agents, meaning independent contractors, which 95% I would bet of the industry are 1099 independent contractors, they're going to be affected a lot, because an insurance agency, they can't run advertising now and pass around the person that filled out the information to anyone in the organization on a rotation. You are considered a third-party marketing organization. It's a TPMO. When the agency owners are the TPMO, every single independent contractor is also considered their own TPMO, their own third-party marketing organization. So you can't be passed along to a different marketing organization technically. So it's good for the consumer because they're only going to be connected with one person. They're not going to get bombarded with a bunch of phone calls, but it does make it really hard for an owner of an agency that doesn't have all salaried employees or W-2 employees as insurance agents, because they now can't run the marketing and pass on that information to another agent. So it's definitely going to make it more difficult. I mean, there's some, like the big insurance companies in general, like the Humanas of the world, Anthem Blue Crosses of the world, their internal sales reps, they won't be affected. You can call directly into the insurance company. But I think that's going to affect the consumer, because now the people that get to bypass the rule are the insurance companies themselves. So if you're calling directly into an insurance company and you want to get an unbiased recommendation, it's not going to happen. The sales rep's just going to want to talk to you about their plan specifically. So it is making it harder for just the average consumer to get access to a broker that can talk to them about all the products they offer in their area.
So it's kind of really changing like the process for agents and how they interact
100%.
with clients, and then for the client themselves, like how would you steer? Because I feel like the way we try to do it is very guiding and very helpful and very, like you've always say, unbiased. Where would you recommend somebody or a client go to know that they're going to find someone trusted? Like you say, if you go straight to the source, well, they're just going to try to guide you with their company and their resources. But like if you go to an agent or someone who has more access, how do they know they're going to trust that person? Like where might someone go to really find someone?
I would say don't go directly to the insurance company for information. If you really want to get an unbiased recommendation, just find a broker. Find somebody that's a broker. And if you reach out to that person, you're fine. I mean, they just can't really... The insurance agencies are going to be the ones that are affected because they can't market the same way they always have. But if you make the effort to find a broker that's local to you and you reach out to them and they have access to many insurance companies in your area, that's the route to success for you. I mean, I want to be biased and say go to Policy Engineer. I mean, our agents, they're W-2 employees. I mean, we train them to not give biased recommendations. I mean, we talk about it all the time. Every single sales meeting, it's training on how to do what's best for the person on the other side, how to do the best for our clients and give an unbiased recommendation. Just collect the data, ask the right questions, and point them in the right direction. But if you're going to work with anybody, find a broker.
Moving into enrollment periods, end of the year, beginning of the year, all these changes, is there anything you're looking forward to, anything you're not looking forward to, just kind of moving into that season?
I mean, I'm really looking forward to the annual enrollment period, because the changes are going to positively affect a lot of people. I mean, if you take expensive medications, which we have hundreds and hundreds of clients that do take expensive medications because pharmaceutical companies charge an arm and a leg for medications. I'm excited to get in there and just see what the actual annual cost is for their medications. I really want to see these changes that were put into effect. I want to see what it actually turns into. I want to see if there really is going to be thousands of dollars of savings. And I hope that's the case. So I'm pumped for that. The new numbers for the Part B premium haven't come out yet, so we'll see what that is. And Social Security is going to release the cost of living increase that they release every year. People are either happy or unhappy when this news comes out. A couple of years ago, they increased the Part B premium, went up a lot. That also came side by side with a very small Social Security cost of living increase. So the Part B premium increase almost ate up the whole Social Security cost of living increase. But we'll see what they do this year. Sometimes they give a bigger increase to Social Security, and then they give a small little bump to the Part B premium, and you get some net increase amount for the year. But I don't know. I'm just excited for all the new changes to come out finally.
All right, I hope you guys got a lot of value from that conversation. If you liked it, let us know in the comments. We'll have more videos coming out like this. If you're not already subscribed to the channel, subscribe, stay tuned for more content. And if you are a Medicare beneficiary or you're turning 65 soon, we have events going on weekly. If you go to policyengineer.com/events, there's a virtual one every single week at 5 p.m. Pacific Standard Time. And we also have in-person events too. Check and see if there's one in your city.